Morning, my name is Lisa Cripps. I work on the nutrition support team. My role particularly involves dealing with any patient, predominantly adult, who have any level of intestinal failure and require intravenous nutrition. This can be done in the hospital or out in the community. And my job, really, 50% of my day is dealing with the inpatients, and the rest of the day can be swallowed up by taking care of the community cohort as well. We have about 30 patients out in the community in Devon and Cornwall under our care. What impact did the COVID pandemic have on me professionally? Well, it was quite tricky. I have a medical condition that meant that I was placed into shielding, so it's not really optional for me to be in the hospital performing my job. I have to work from home. So the 40-minute commute to get into work has now become from the end of my bed. My bedroom is now my office. The adjustments that we've had to adapt to really are the lack of face-to-face contact, having to use your mobile phone for any communication you make with your patients, and electronic contact, be it either through email or using the Microsoft Teams as well. But the important thing was maintenance of the continuity for the patient care, and also to maintain the way that our team functions. If I had a key message, what I would say is that things like this can be anticipated, but they can't actually be scripted or pre-planned into your diary. So my message would be flexible, let this evolve, try not to be too rigid and roll with it. And be creative. Don't let the fact that there's no precedent for this in our lifetime limit what you can achieve. So I'm kind of reflecting on the second week of being in shielding and remote working. I nicknamed this week Humble Bugs, because you know what your peers and your colleagues and friends are going through, and you can't be part of that. So the sense of guilt you have is huge. It's quite humbling because you know that your colleagues and the trust are keeping me safe. And it's really, really easy to overcompensate for that. You feel a sense of needing to justify the support that you've been given. And you need to try and find a way to alleviate the thoughts that go through your head about you being burdensome to the trust and to your colleagues. Lone working's really intense. There was quite a big sense of urgency in the second week of being in shielding, because there was a lot of work on the outpatient prescriptions where there was an urgency about it, because if the home care providers had problems with compounding capacity or workforce, then we needed a plan B if they couldn't provide the treatment that our patients have. You work differently. It's certainly a lot more independent. It forces you to problem solve in quite unique ways. My annual leave was cancelled because of the amount of work that needed doing quite urgently. And you're working harder when you were mentally prepared to be resting. So that was quite tricky. But I think a key message from working from home is that you do all that you can, but not without hurting yourself. And you do all that you can and not necessarily what you think you should, because it is different. It's very tiring. And it was really important for me to remember that I am helping, but I'm just working in a different way. And keeping things in perspective, we're all in uncharted waters. And there are always scenarios that we're not ever prepared for. And I think a pandemic, professionally, is something that I've never seen in 30 years of nursing. So we're in week 3 of shielding. I nicknamed this week Reflection, because where am I at? Where am I at in the third week? Obviously, we're still shielding. Our family has an increased sense of togetherness. We've created a strategy on how we're going to cope with this and try and come out of this still speaking to each other. I think a highlight for me was we had a night of cheesy music. So, we played through Sonos, music that you'd never confess to enjoying out loud, and certainly not in public. Getting the work-life balance right has been quite important. My husband and I both have our own workspaces. I mean, he definitely got the better end of that deal because he got the spare room. I'm working from a dressing table. But, we have set workspaces. Home is home and work is work. Even if the commute from home to work is the distance from the end of my bed. Mental health wise, the Trust's been absolutely fantastic. They've given us access to Headspace. You can take time out. You revert to your usual shift pattern, because I did modify the way that I worked for the first 2 weeks, but actually that doesn't suit me physically and certainly not mentally. And you just have to recognise you have a different level of control. You don't have as much control as you used to have, and there's certainly not an awful lot of contact or discussion. But I think the important thing mentally was to not fight that. You just have to roll with it and do the best that you can and accept the things that you can't influence at the moment. This is temporary, it's not going to be forever. And it's okay not to be okay. Physically, it's quite tricky because I'm spending 100% of my working time on a computer, so it's taxing from an eyesight point of view and mentally, and it gets you down being on your own for that length of time, and it's frustrating, really, really frustrating. But I guess a key message really is go easy on yourself. Nobody controlled this, no one expected it, and don't beat yourself up. Just do the best that you can, and then your conscience is clear. Accept things when they go well, and then accept things that happen that are beyond your control. But there is such a massive amount of support available for those of us remote working from the Trust, and it's phenomenally humbling. It's brilliant. So I'm talking about week 4 in shielding. This one's really more about support and signposting. Our patients have quite complex healthcare needs. As I said in previous session, the contingency prescriptions was quite taxing. And they also come back to you with lots of questions. They need lots of reassurance, lots of empathy and understanding, and they need somebody to listen to their anxieties, but somebody that knows them as well and understands the treatment that they're on. So you do have to really draw on how well you know your patients, use your active listening skills. In many respects, your counselling also, because their anxieties and trying to allay their fears and understanding their predicament. But for me, as being a nurse and being in shielding and having a medical condition, it kind of puts us on the same level. So you kind of let them know that we're all together and we might be isolated, but there is someone there for them. I mean, I am on the end of a telephone or at the end of the emails, and they know that. But also, the level of insight into what shielding feels like is really, really helpful, because, when you have patients that are grieving or live alone or who live in flats, to have the level of understanding really, really helps. Then with the pandemic, obviously you still have a responsibility to maintain your clinical governance, and does this pandemic justify changing a clinical policy? It needs to be proportionate, and safety needed to be paramount. And there was a lot of information coming out that people were questioning, do we have to change, do we have to do X, do we have to do Y? But actually you take a step back, you think rationally, you consider the points that were being raised, and you think, does this make safety better? If it does, great, then you discuss it and consider change. But if it's not actually improving change, it was quite easy to get drawn into something. But again, step back, be rational, and, I think in the end, the right decisions were made. We also now have access to Microsoft Teams, which is a brilliant new way of working. It's a bit weird, but actually that sense of togetherness and seeing your colleagues for the first time in over a month was fantastic. I hadn't really appreciated how much I'd missed them. And, a key message for me is, we are in specialist roles. It's a unique relationship with the patients that you have. I've known one of my patients for 16 years or more. And it's okay. I may be a nurse, but I'm also human, and I can really appreciate their personalities, and I think they appreciate mine. I don't think anyone finds it easy to support others, especially when they're in the same boat as you, and when you're not feeling like supporting anyone because you're feeling rubbish. You still have that responsibility, and that's tricky, but it's been interesting to go through, and I'll certainly be a better nurse for it. Um, and you do use the skills that you've developed to maintain a level of professionalism, but that that whole relationship slightly alters in that you are a lot more in tune with a sense of empathy and humility. So we're in week 5 of shielding and remote working now. I think this week we've hit a plateau. You're checking for updates from your specialist professional groups. You're touching base with your peers in regional hospitals. There's still quite a lot of ongoing support for the community patients, lots of counselling, lots of reassurance. And what's really quite funny is having used the Microsoft Teams. I mean, I'm 49 and I just think it's hilarious that at my age I'm getting my head around this new modern tech. You know, I am starting to sound like my parents, I think. But, you know, with that e-contact, it really has created a bit of a recalibration for me, for my team, and for our patients as well. And it's been interesting. It's been a calm week. It's been a good week. And there's not been any major problems at all, which is really, really nice. So this is week 6 of shielding and remote working. And I think this week we are, as a team and as a service, we're ticking over quite nicely. Myself and my colleague have adapted our roles, whereby I'm working on the outpatient cohort and managing that remotely, and she's managing the inpatient activity. And any phone calls that come in, she pings an email to me and I pick up that activity. So between the two of us, we've essentially split our service in half. And I'm not under any illusion that it's probably harder for her than it is for me. But I guess I don't know. I don't know whether she's ever considered what it's like for me. I don't know. And that's one of the other things, you don't actually know what people are thinking. You know, there have been issues overcoming remote working because I'm a non-medical prescriber. So, you know, there have been governance issues with that. And we've had to be patient and wait for a directive. It's been quite interesting. You can still do some CPD. A lot of the companies that we deal with are holding webinars, and it's been interesting to actually see some of the critical care webinars on how people progress through this disease, and what their nutrition requirements have been, and that kind of thing. It's really, really interesting. I'm not a critical care nurse anymore. My job is now nutrition. But having done critical care for 19 years, you know, you still have a level of insight. You're just probably not 100% with the technology. But so it's been an interesting week. It's been nice. We're still carrying on working on the policy and the audits and things that we have to take care of. But things have ticked over quite nicely. Things, you know, are plateaued. So this is week 7 into shielding and remote working. This week's been really, really tricky. We've had a bit of a crisis on our hands in that one of the suppliers for a treatment that we provide to patients out in the community had failed. So the supply chain ended, and we have people waiting for deliveries of treatment that we couldn't actually get to them. The most pressing issue with that is the fact that we need to maintain patient safety, and we need to do that quickly, but with adjustments for the COVID crisis. And we also needed to make sure that their treatment continued, but their exposure or risk of COVID transmission to them isn't compromised. It's been a really difficult week and quite frustrating, but the key message was you have to have full-on specific lines of communications. You have to be flexible, and you have to have trust in those people that you're communicating with remotely. It is a modified way of working, and as frustrating as it is, you just don't lose your sense of focus that there is a patient on the end of this crisis that we need to keep safe. We needed to be quite efficient and make sure that we came out with a positive outcome. And the hardest bit again is just don't feel guilty. You can only do what is within your gift to do, and you rely on others to work with you for the same end. So week 8 into shielding and remote working, you hear lots of phrases about the new way of living, the new ways of working. And having reflected on the last 8 weeks, I'm wondering what the patient experience has been and how we as a team can learn and improve from it. Let's explore the future of our service and which direction we could potentially take it. It'd be nice if we could do a patient experience survey to find out what they would like to keep and what they would like to get rid of, in the way that we've maintained contact with them throughout the pandemic. I think for me, this has been quite a significant event, and it's demonstrated that we are quite capable of working in novel ways and creative ways. It would be nice if we could tap into that to improve the patient's future healthcare contacts. And also, have a look at the resources that we have. Because if we can have electronic consultations, then that could make more efficient use of resources, i.e. it might actually free up some of the consultation rooms that are at a premium sometimes. Good morning. So today I'm going to talk about what it feels like to be in shielding. As I said in my previous entry, I have both inpatient and outpatient contact, and I miss them all phenomenally. I think the hardest part about that lack of physical contact with the patient is the fact that you can't actually judge their non-verbal cues at all. So I have no contact at all with the inpatient cohort. With my home patient cohort, the contact that I have is a little bit more creative, in that we use electronic communications predominantly. I don't think any of them have dared to video call me yet, but all of the patients that do need access to me have my personal mobile number and my NHS email number as well, because if there is anything that needs to be shared with my team, I can do that in a confidential manner. I guess with the home cohort, I've known them all throughout their journeys on the intestinal failure front. So although I don't have non-verbal contact with them in order to make an assessment whether they're telling me the truth or there's something they're holding back on, a lot of them I know their tone of voice, and that has been invaluable. Certainly with one of my patients that had quite a few bereavements recently, and upon discussion with my nurse colleague, I felt very much that actually enhanced contact with that person would be beneficial for them, so that although they're shielding as well, there is somebody that A, knows what shielding is like, and B, is there for them whenever. And that's worked really, really well. As I said in my previous video, 50% of my time was spent on the wards, and to go from doing ward-based care and having clinical contact with your friends and your peers that I've known for 20 odd years now, 27 years, to go from that to be completely detached from them and disassociated from them, it's quite a culture shock, and it took quite a lot of time to get used to. But luckily, a few of them are friends with me personally and on social media. So there were other ways of saying, yeah, I'm all right, how are you, kind of thing. But as far as shielding, the only way I can describe it is to completely detach from the world that you were actively part of. So both personally and professionally, you basically withdraw into the four walls of your home. You have no physical contact with anybody outside that home, and anybody that wants to have contact with you inadvertently is a threat to your safety. So it's quite tricky to get your head around. I live with my husband and my two sons, and when the sons came home from university, the hardest part as being a tactile mother is knowing that potentially they could be incubating COVID. So we did socially distance for the first 10 days, 14 days at home until we were quite confident that nobody was carrying it. And in those times, I would be on one sofa and the three men would be on the other. We're fortunate in that we have more than one bathroom, so I have my own little boudoir, and the men folk share the other bathroom, which is quite nice actually, because I can be as tidy or as untidy as I want to be. And that was okay to a point. Money has absolutely no use to you. Cash money has no use whatsoever. The coins that are in my purse have stayed there because I'm not able to actually physically use money in the old-fashioned sense of the word. So the way that you shop and the way that you buy gifts for people completely changed. It's a really peculiar state to be honest with you. You can you spend your time at home and you can see the world and you can hear the world going on, but it's without you, and you see it happening and you can't connect with it at all. What we did decide was that because of my condition and the fact that I'm shielding, it made more sense for the four of us to shield together so that I don't feel like the odd one out. So we all acknowledged that safety of our home environment was paramount. So we created like a battle plan, how we were going to keep ourselves entertained, either by using the TV, music, Uno, books, jigsaws, and it was quite apparent that food was the only thing that we could control. So the weekly deliveries became like a highlight of joy because it was like, oh, what have we got this week? And what can we make with X, Y, and Z on the grocery order? I think on reflection, before COVID, our home was just a place where we sheltered from the weather, where we slept, and a place to be together, but we didn't really consider it any more deeply than that. It was a means to an end. Whereas now, during shielding, it's quite apparent that we're grateful for the space that we have, the size of our home. We're very thankful that we have an outdoor space, especially with the weather being as good as it has been. And I guess it does make you more mindful and aware of how fortunate we are to live here. On reflection, material things don't actually matter. Shopping for nice things and treats don't really matter because you can't do it anyway. But what does actually matter and what it really hammers home to you is how important your family are, how important your friends are, and how much you miss your colleagues. And the house in itself, the characteristics of our home have actually come into their own, and we've really appreciated the space that we all have, and the fact that we are able to be together for this length of time. I mean, we're at 10 weeks now and we haven't yet had a falling out because we're not cooped up in a confined space. The hardest parts from a practical point of view was the grocery shopping. We nominated my husband to do the grocery shopping because the boys are not very good at creating meals out of nothing. So he went off to do the shopping, which, dear of him, it was so stressful for him. The responsibility of knowing that if he made a mistake or if someone contaminated him, he could contaminate us. So he used to come back from the shopping, plonk the groceries on the kitchen floor. Everything that he was wearing immediately went into the washing machine, and he went straight upstairs and took a shower before anything. And the responsibility was massive. So fortunately, by registering on the government's website, about 2 weeks after the shielding started, we were able to access online priority deliveries with one of the main supermarkets. And that's been a lifeline for us because it meant we could completely shield. None of us leave the house at all. And it's something that you take for granted. A trip to the supermarket is something you do without thinking, but actually the whole concept of your grocery shop completely changes. Professionally, you do feel guilty because you're not actively part of your team in the physical sense, and you are very mindful that the trust has made it possible for me to work from home. And with that, you have a sense of duty and a responsibility to make the most of the time that you have, to work as well as you can under these circumstances, and to not, to show respect to the fact that your peers are working without you on your behalf, and the trust is permitting you to work from home in order to keep you safe. And the sense of gratitude that you have for that is phenomenal. You do feel quite burdensome. You feel very aware that you're not probably doing 100% of what you could do, but you're doing your best. The sense of detachment from your team is huge, and obviously the software that the Trust has made available for us has been fantastic. The use of Microsoft Teams, the psychological support, and you know, we are managing to keep the communication going, so we don't appear to have had any major blips within our service at the moment. Psychologically, being cooped up with shielding, certainly good weather helps, because you can sit outside, you can calm yourself down, you can reflect on things that are bothering you. You know, working differently initially in the early weeks did create a lot of tension and a lot of stress, so I did make use of the Headspace app that the Trust has made available for the workforce. I never meditated before this, but I have found it completely constructive. It changes the way that you're feeling, it changes your mindset, and it really helps you refocus yourself and relax and kind of put things in perspective, and it's not a conscious part of what that app is. As I say, you do feel a massive sense of responsibility to the Trust for what they're doing to help me stay safe, but also to keep me working. But also, you know, your home is your safe place. It is a bubble of safety. And just the thought of leaving the front door or the house at the moment, there is an anxiety that comes with that thought process. But again, that's going to have to be a work in progress, because at some point I will leave the house and I will return to work, and I will have to live and work with the risk that COVID presents to me as someone with a medical condition. The hardest part personally in all of this is the lack of physical contact that you can have with people. You know, when my boys came home from uni, not hugging them was awful, and sitting across the living room from them on a different sofa, whilst it was lovely to be together, not actually being in the middle, because obviously I'm the only female in the house and it is all about me, of course. That was quite tricky. But you do, you know, make novel ways of keeping in touch with other people that are important to you. So you make virtual family contact, virtual contact with your friends. It's really hard. It's really hard personally, because you just don't know when this is going to end. I should have been out of shielding on the 15th of June. It's now the 30th of June. We have to look at the R factor to see whether or not that's going to happen at all. So it's hard. It's hard not knowing when this is going to be over and when we can relax a little. And the sense of guilt that you have personally, because without my medical condition, my family wouldn't be going through what they're going through, and nor would my team. And that sense of guilt isn't easy to live with. But, you know, we're 10 weeks in and hopefully they're all speaking to me.